Welcome to today's webinar on cognitive telemedicine using AWS PubNub and SourceFuse DocBot. Today, we are joined by Joe Norman, who is a solutions architect at AWS, and Kabir Chandok, who is COO at SourceFuse. So why don't you guys go ahead and introduce yourselves and what you do.
Sure. Like Eric said, I'm Joe Norman. I'm a partner solutions architect at Amazon Web Services. And what that means is I work with software companies to help develop and bring solutions to market and solve customer problems.
Cool. Kabir?
Hi, good morning or good afternoon, wherever you are. My name is Kabir. So I'm the CEO of SourceFuse. SourceFuse is a technology consulting company. We work with medium and large enterprises and help them in innovating, leveraging what best the cloud has to offer. So we're AWS partners and we're partner partners as well, and we solve customer problems like Joe said, using cloud technologies like these.
Cool. All right. Well, thank you for joining. We're really glad to have you both here to talk about this subject. And what a subject it is. So today we are going to end up focusing on DocBot, which is an application that SourceFuse has built on a really interesting stack of cognitive technologies offered by AWS. To get there, we're going to lay out some context for what the telemedicine landscape is like today, sort of where it was really before February, and what's happened since COVID. What has changed to make it more important, more necessary, and more accessible. Kabir is going to then intro us to SourceFuse, what is it and what its goals are, demo the app, and is going to hand it off to Joe to dive into kind of the pieces of AWS technology that are at work here. And we'll sort of wrap up by sort of tying it all together with what these technologies do to actually help DocBot achieve its goals in the context of making healthcare accessible to more people worldwide. I also want to mention that as a thank you for attending, we are offering AWS credit to attendees. So stick around to the end and we'll share some details for how to take advantage of that. So with that, I'm going to hand it over to Kabir and take us away with telemedicine today.
Sure. So what I want to do is, before we get into telemedicine, start with a few grim, numbers about the general healthcare landscape before we get into telemedicine, right? So up to 3.5 billion people on the planet right now don't have access to the healthcare they need, right? Couple of other things. 800 million people spend as much as 10% of their household income taking care of a family, of a family member or a loved one. 100 million of these guys are pushed down even below the poverty line just to meet healthcare costs, right? And while this is obviously an urgent issue for emerging and low-income countries, it's also an issue for more developed countries as far as getting access to sustainable healthcare as far as possible. So statistically, about 40% of all WHO member states have less than 10 physicians for every 10,000 people in their population, right? And the numbers are so skewed is that countries with the lowest relative need of physicians actually have the highest per capita physicians, and obviously vice versa. Case in point, the African region suffers from more than 22% of all global disease burden, but they have access to as little as 3% of the healthcare workers, and access to financial aid is even less. It's as low as 1%. So obviously, the global view of the healthcare system is way fragmented. It is extremely skewed. And it's just not fair, right? And if you really look at it, it doesn't need to be that way. All why we're suffering is purely by constraints of geography, right? And everyone knows we're on a Zoom call right now. We are not constrained by geography. Most businesses over the last few decades have not been constrained by geography. Everything has been globalized, but healthcare, right? So why does healthcare, need to be the laggard that it always has? Is what we look at, and we'll also look at some recent developments on how that's changing. So considering we're talking about telemedicine, I'm guessing everyone in the audience is well aware of what it is. But just for the sake of definition, telemedicine is nothing but the electronic exchange of health information from one side to another, with the goal of improving a patient's health. Right? It's as simple as that. So, and I know this quote, most people would have heard. It's been thrown around a lot in the past couple of months. Is that there are decades when nothing happens, and then there are weeks when decades happen. And I don't think that there is a case in point, more where this is more relevant than in the healthcare landscape, and also in the US healthcare landscape, right? And we'll see, what happened and what transpired in these few weeks. But it's in no way is it trivial, right? So, like I said, everyone knows that healthcare has always been the laggard as far as being an early adopter of technology is concerned, and there's obviously good reason to that, right? So it's a heavily regulated industry. There are obviously concerns of patient data security and privacy, and so forth. And then there's also the aspect of the physicians, right? So while other businesses are more sort of lean in adopting new technologies, here we're dealing with with people, with professionals, not necessarily akin to a lot of technology. So early adoption can cause it can cause fatigue, it can cause inertia as far as adoption is concerned, it can cause physician burnout because they've already got so much on their plate. And then it can obviously increase a lot of administrative workload as well. And if all that happens, ultimately what's going to happen is the patient's going to suffer because the patient outcome is going to come low. So how did the last few weeks change all of this? Let's start with let's give credit where it's due. The US has had a head start. What Obamacare did was they passed legislation where hospitals were penalized if a patient was readmitted within 30 days of discharge. So in order to kind of mitigate that, it kind of incentivized hospitals to adopt more technology, telehealth, telemonitoring, especially, looking at patient vitals and such while they've been charged, making sure that, you can kind of intervene when you have to, and kind of avoid the patient coming back to the facility. Obviously, the net beneficiary of that obviously is the patient and his health. So while that was happening, what we also saw is that, the US started kind of maturing in its use of at least ICU services, with an estimated 11% of all ICU beds under telemonitoring, and being enabled by technology like that. So studies in the US prior to COVID-19 actually show that under telemonitoring, there was a 26% reduction in death rate and 30% reduction in the length of the stay at an ICU than without the telemonitoring bed. So that's a little bit of the kind of head start and a little bit of momentum that the US already had with adoption of these kinds of technologies is concerned. Now, fortunately or unfortunately, thanks to COVID, a lot of things have changed. In January, and and this is probably coincidence, the US came out with 6 new CPT codes. CPT codes are basically current procedural terminology. It's just procedural codes that are used to file a claim, when a doctor does, say, even a simple thing as a consult, right? So these 6 CPT codes were, basically tailor-made for teleconsultations, for telehealth, for what they refer to as patient portals. So, if your doctor has any kind of technology-enabled solution that lets you as a patient initiate, a virtual visit, there are now legitimate, billable codes that doctors can use to file claims for, right? And so this was done, well, almost pre-COVID, is before COVID became a thing, at least in the US. There are also now 2 new CPT codes that let physicians monitor blood pressure while a patient is home. So a patient can actually initiate a teleconsult saying, "Hey doc, my reading is so and so. Do you think there's anything to worry about? Should I up my meds or whatever?" That's also a legitimate use case, and your doctor can file a claim for that. Now, to bill for these services, the law actually stated that the patient must be an established patient. What that means is that there should already be a pre-existing relationship between the doctor and the patient. That has been already kind of waived off as part of COVID. So now you don't need an existing relationship with a doctor. You can go to a brand new doctor, reach out to him, and Medicare and Medicaid will actually cover your expenses to the point where while there are there can be co-insurance and there can be deductibles, but the recommendation there is to kind of waive them off as well, and that's obviously the physician's prerogative. But as you can see, there's already a lot of momentum with telemedicine and these use cases, and how kind of behavior is changing both on the provider end and the patient end. Another really big kind of development that's happened over the past couple of months is the CDC has actually formally urged healthcare providers to communicate with patients virtually wherever possible, right? And there's obviously good reason to that. Patients are obviously extremely, or they may not even be patients at that point in time. People are extremely, concerned with so much, floating around in the media. Do they have the virus or not? They may be showing symptoms of, relatively milder disease, but they want to reach out to someone. They want to feel good about that. So that's obviously the number one use case where the CDC is saying, please tend to these people, but they don't need to come. They don't need to come to the clinics. Just tend to them virtually and help them out. The other one is obviously people who are more aged. They're old people with pre-existing conditions. They have comorbidities, and the last thing they need is to get exposed to something like this because they're already so vulnerable, right? So that's basically the second use case where this is becoming so critical right now. The third one, obviously, and this is probably the biggest, which is to do with the whole flattening of the curve, is try to reduce exposure to the healthcare workers as much as possible. Your doctors, nurses, the triage team, right? There is absolutely no need to kind of flood clinics, hospitals, physician offices with people while you can, take care of them very reasonably, with a technology solution. And then, let's not also forget about livelihoods. There's certain small kind of, single doctor clinics, especially in places like New York and Seattle, where, at one point of time, there were a lot of cases and patients just stopped coming out, right? Because there was shelter at home orders. So what's a doctor to do there? So if there wasn't a legislation like this, if there wasn't a waiver, if they weren't allowed to do this, you're actually putting livelihoods at stake. So that obviously was a big kind of lifeline that was thrown to these smaller practices. And then one indirect side effect is, look, if I'm going to go out and meet a doctor, and there's going to be thousands of us like this, we're going to be wearing masks. We're going to be wearing some sort of personal protective equipment. And that equipment is probably best utilized by the healthcare staff themselves. So I don't need to waste it. What I need to do is just stay at home and be safe, right? So for those 5 or 6 reasons, I mean, the CDC obviously urged everyone to use, virtual healthcare solutions as much as possible. And, you can see that in the numbers now. In a recent survey, nearly half of the respondents said that they've either have or they're planning to do a teleconsult. Most remote health kind of solutions out there, and their startups and their more mature companies have reported up to a 50% spike in televisits over the last couple of months, and 50% is on the lower side. There's some that are doing 100,000 visits a day. There's some who've grown at some 650% over the last quarter. So the numbers basically tell a story. The other the waiver, which is called the 1135 waiver, right, came from the US government on the Medicare website, which basically says that doctors can now do teleconsults either from the clinics or even from their own homes. So this was legislation that has changed actually. Earlier on, a doctor had to be in a kind of healthcare facility even to do a teleconsult. Teleconsults were limited to people in designated rural areas, and even then they had to drive to a facility to do the consult. So all of those kind of rules have been broken down. It's anyone can do that now. Earlier on, you wouldn't get or you couldn't get paid at par with a face-to-face visit, as far as versus a teleconsult visit. Now it's the same. You would get paid exactly as much as you would for a teleconsult as you would have to a face-to-face. So, like I said, more has happened in the last few weeks than has happened in the last few decades, as far as adoption of these kinds of technologies is concerned. Another one that's happened is, again, is on the funding front, right? So the FCC actually came out with a $200 million program under the CARES Act. So it allows not-for-profit, healthcare facilities like, it could be a teaching hospital, it could be a community health clinic, and so forth, to apply so that they can basically leverage these kind of technologies, and they can use that money to spend on things like internet bandwidth, devices, tablets, and maybe some SaaS solution that actually lets them do the consults. So these not-for-profits can file for reimbursement up to about, I think, $1 million per clinic. So there's obviously so much momentum now in this that it's obviously it's not just going to be a COVID thing anymore. User behaviors are going to change. Physician behaviors are going to change. They're going to warm up to these kinds of solutions. They're going to start realizing how by kind of triaging these kinds of cases, they actually have more time to do more high value things, right? So they have more time to research, they have more time for more critical patients and so forth. So there's really going to be a shift in how care, how care is delivered, as far as the criticality of the patient is concerned, and their location, their geography, their demographic, as far as what they can access at that point of time. That's going to undergo a massive paradigm shift. There's talks now that they're even going to allow prescription of controlled substances over these kinds of portals that do teleconsults. So what's going to happen is physicians, unfortunately or fortunately, are going to be, overwhelmed by these solutions, right? There are obviously going to be a lot of them out there. There's obviously going to be a lot of traffic, patient traffic as far as they are concerned, right? Patients tend to get anxious. They tend to reach out to doctors a lot when they're sick. So, imagine if if you could basically reach out to your doctor at any point of time, right? You would do that a lot.
And Joe, take it away.
Thanks, Eric. So I'm going to talk about those 4 services that you just saw listed on the last slide. The first one that was listed was Transcribe Medical. So Amazon Transcribe Medical is a machine learning service that makes it easy to quickly create accurate transcriptions from medical consultations between patients and physicians. So where you saw that service on the demonstration was where Kabir was speaking into his microphone, and it was a speech to text, so transcribing his speech into text. And Transcribe Medical is specifically focused on medical and pharmacological terms used in things like physician dictated notes, patient consultations, and telemedicine, like the DocBot demo you just saw. And it's for use in clinical documentation applications. Some of the benefits are that it's highly accurate. So it provides a real-time speech to text built for machine language using state-of-the-art machine learning models. It cuts down the time that physicians have to spend taking and editing their notes manually. It allows them to speak in natural speech. They don't have to say things like, they don't have to verbally speak out their punctuation, for example, and it can capture either a single speaker taking notes or conversations between multiple people and note down the different speakers of that. It also automatically normalizes any numbers so they don't show up in different forms, like the word form of a number and the numeric form of a number, and that becomes helpful later when you're pulling out key values. There's also a lower medical documentation cost with it, so there's no licensing fees. You're just paying for what you use, and it works via APIs. And it tends to replace expensive human scribes and save doctors time that they're spending doing this transcription. So the cost savings add up pretty quickly with that. And because it's in the cloud, it can scale across thousands of medical centers globally instantly. Some of the use cases, you saw the telemedicine use case. Other use cases are dictation, so dictating notes, conversational transcription, which is what you saw, and drug safety monitoring, so things like calls between patients and doctors or doctors and pharmacies, and it can capture the names of medicines and key terms describing side effects. So the next service I want to talk about on the next slide is Amazon Comprehend Medical. So that is our natural language processing service that makes it easy to use machine learning to extract relevant medical information from unstructured text. So where you saw that in the demo was where it was pulling out terms like ibuprofen and Panadol and analyzing those. So the app itself takes the data pulled out and it checks it against the medical record of the patient. So that pulling out of the key terms, the medications in this case, is done by Comprehend Medical. So it gathers information such as medical conditions, medications, dosages, strengths, frequencies of medication, and it can determine the relationships between those key value pairs, things like medical dosage and strength relationship. You can also send it sources like doctor's notes, clinical trial reports, patient health records. So basically any unstructured text, but this is specialized in obviously the medical field. We also have Amazon Comprehend that's more generic. So it can link detected information to medical ontologies such as ICD-10-CM and RxNorm. And I have no idea if I'm saying those the way they're supposed to be said, but those are some common medical ontologies. And that allows it to be used easily downstream by healthcare applications. It removes some of the need to write and maintain a set of customized rules for NLP software. So the way this would be done traditionally is NLP software would have a large set of customized rules that have to be maintained by either you or a vendor. This eliminates that need, and it uses a model that updates itself automatically over time and constantly improves. So things like classification, code names changing wouldn't break this system where it might break a rules-based NLP system. So some of the benefits of it, one, it uses API calls, so you need again, just like transcribe medical, you just need to know as a developer how to use RESTful APIs. You don't need any ML experience. You don't need to train models, and you just pay as you go, no upfront licensing. Some of the other benefits are, a big one is it protects patient information. So it is HIPAA eligible. It helps healthcare providers stay compliant. And you can identify PHI stored in medical record systems with it. It's also GDPR compliant for EMEA, and it doesn't save or store any customer data. With this, some of the use cases are performing a cohort analysis for things like getting a pool of candidates for a clinical trial. So it will help you quickly and automatically find potential candidates based on some things like medical conditions and drug allergies. It can support clinical decisions. So you could do things like make dashboards for care support teams, and maybe do something like create a warning system for any individuals who are at risk for certain medical ailments. And finally, it allows you to improve medical coding in revenue lifecycle management. So the third service is Amazon Translate on the next slide. So Amazon Translate, it's what it sounds like. It's our neural machine translation service that delivers fast, high quality, and affordable language translation. So what neural machine translation means is it uses deep learning models to deliver a more accurate and more natural sounding translation than a traditional, like a statistical model or rules-based model. And just gives a more natural, more accurate output. It takes into account the entire sentence context, not just small blocks of words and phrases, as well as the translation that it's done up to that point, to create an entire context-aware sentence that makes more sense when it's finally translated. Like the other services, it's always learning from new and expanded data sets. That one was pretty obvious to see in the demo as well, where Diego was speaking in Spanish and the doctor was replying in English, was seeing it and replying in English, and it was automatically translating back and forth between English and Spanish. Some of the key features are it covers a broad swath of languages, 55 so far, and that's always growing. The permutation of that is 2,970 possible language translations from one to another. It's low latency. For a full proper sentence, it's on average less than 500 milliseconds. And for shorter phrases, like you saw in that chat, the short phrases people tend to type into chats and things, about 150 milliseconds on average. For security, for data in transit, so client to server, it's encrypted with it can be encrypted with SSL. The data that's processed by the service is encrypted at rest. And administrators in AWS can use identity and access management to control access, to make sure that information is locked down to only the people who should have access to it. Next one is named entity customization. Sorry, it's on the same slide. Yep. And that allows you to define how terms or names or things like company names that might be a common word, that are unique to your organization, domain, or industry get translated. And you can define those either broadly or by individual languages, how those get translated. And this is an optional feature. That decreases the amount of human editing that's eventually needed for the translation. Next is HTML batch translation, which allows you to, using our asynchronous batch API, to translate HTML documents and maintain those HTML tags. Next is ease of use. Like the other services, this is using APIs, and it offers real-time or batch APIs, so synchronous or asynchronous. And then finally, this is trained on 11 different domains, so we have broad domain coverage. The last service I want to talk about on the next slide is Amazon Polly. So Amazon Polly is, so we had transcribe, which is speech to text. Polly is text to speech. Like the other services, it uses deep learning technologies, and it synthesizes natural sounding human speech. It's got a wide selection of voices and languages, so it's got dozens of lifelike languages, lifelike voices, and supports a variety of languages. So it gives you the option to use a standard text-to-speech voices, or for a premium to use neural text-to-speech. Our website has some examples of what the differences, how different they sound. So that the neural text-to-speech sounds a lot more natural, more like a natural human voice. You also have the option to record your own brand voice, and we've seen some companies do that where they have a brand voice. You might think of companies like, I probably shouldn't name it, but companies that have, say, a mascot, and you want to do something in that mascot's voice. you're able to record and set up Poly for that. So it also allows you to synchronize speech. So it can provide an additional stream of metadata that gives you that provides information on when sentences, words, and sounds are being pronounced in a speech, and that allows you to do things like synchronize facial animations, do karaoke style word highlighting. So if you wanted to have a 3D bot, it would allow something like that. It allows fine-grained access control of sampling rates, audio formats. You can use speech synthesis markup language, control speech pronunciation, volume, pitch, and speed. And we also have our own tags, and that enables things like newscaster voice. And finally, it allows unlimited replay. So you can, if you do say, if you choose to download the generated speech, you're free to use that as many times as you want with no additional charge.